And good morning, I'm Dr. Deuk. Welcome to our live stream from Deuk Spine Institute. Our patient is from Canada, and he has very bad back pain. He's had it for 25 years. AP? We did a Zoom call, and on that call I diagnosed him with 3 things causing his back pain: disc, facets, piriformis. Oh, look at that. He's got some spina bifida. You guys see it?
Yes, we do.
Show us, Jordan. You can see there's dysraphism, no down, right there, exactly there. You see how that lamina doesn't come together perfectly? It's right there, exactly. That's the dysraphism. So we call this spina bifida colta. It's just the way he was born. And anyway, it doesn't really cause any symptoms, but maybe it predisposes to back pain. Shot? So we know he's got 3 discs that are causing his back pain, and 4 facet joints, 2 left, 2 right. AP? We're almost where we need to be at 5-1. We're going to fix the L5-S1 disc herniation, the L4-5 disc herniation, the L3-4 disc herniation. Looks perfect. So far, his surgery is going very well. We're going to first fix the 3 discs causing back pain, and then we're going to move on to his facet joints. We'll do that as a separate stream. Thanks, Jordan. If you have questions, feel free to ask. Well, got lucky on that one. Went really well. Now, if you are listening to me, you heard me say that he has 3 different things, 3 different sources of back pain: disc, facet, piriformis. And of the discs, there are 3 discs causing his back pain. There are 4 facets. So how many discs are possible to cause back pain? Well, there are 5 discs in the lower back, so I guess 5, right? And of those 5 discs, Shot, which one is the most common disc to cause back pain? The answer is, Nikki, good job. L4-5, Shot. L4-5 is the top disc. After L4-5, there's L5-S1, then L3-4. In that order. After discs, the facets are the second most common cause of back pain. And finally, the sacroiliac joint and piriformis muscles are about the same in terms of causing back pain. They are the 3rd and 4th most common cause. But let's show the audience all the different causes of back pain. Shot? I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Machen. Thanks for joining us. Welcome back. You can see from our animation there are many causes of lower back pain, but we know all of them. And the most common by far is a disc injury. We'll call it disc injury because many of you know the disc injury by different names. Some of you know herniated disc, some of you know slip disc, some of you know bulging, ruptured, extruded, degenerated, spondylosis. There are many, many names for disc injuries, but they all mean the same thing. It's a tear in the back wall of the disc shot, and that tear is very painful. It gets inflamed, full of inflammation, and causes horrible pain. If you take all patients with chronic back pain, 85% of them, it's mainly due to the disc injury and disc pain. That's why we do the Deuk laser disc repair. This is the right surgery for 85% of patients with chronic back pain. This fixes the back pain. The second most common cause is facet joint pain, and we have a different procedure for that. We're going to have another surgery following this where we treat the facet pain. And finally, you have SI pain and piriformis. Those four causes, disc, facet, sacroiliac joint, piriformis. Deuk Spine Institute, we're the first in the world to describe the incidence and prevalence of these conditions, and they are now curable here at Deuk Spine Institute. So 99.5% of chronic back pain is now curable. It includes disc pain, facet pain, sacroiliac joint pain, piriformis pain, and fractures of the vertebral bodies. That's 99.5%. and all of them are curable with one procedure for each of those treatments here at Deuk Spine Institute. Each diagnosis has its own specific treatment, and we have those treatments here at Deuk Spine. Any questions?
At this moment, no current questions.
All right, thanks, Henry. So we're going to be repairing this disc first. This is L34. I tested these discs while you guys were watching the animation, and I tested them for pain, and indeed all three are causing his typical back pain that he gets every day. The most painful of the three was the bottom, L5S1. That was a 10 out of 10. The other two were 8 out of 10s at L34 and L45. Now that's the tear right there. Henry, let's show the audience, since there's no questions, how is it that a disc injury like this, herniated disc, is going to cause back pain?
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You can see from our video how an injured disc can cause so much pain. It's through a process called inflammation. The inflammation happens in the back of the disc, in the back wall, called the posterior annular tear, and that inflammation is the source of back pain. Get rid of the inflammation, you get rid of the back pain. So how do you get rid of that inflammation? Well, we developed the perfect surgery for that. It's called the Deuk laser disc repair. We've been performing it now for almost 20 years. We're at 19 years now, since 2006, and the success rate is 99.6. That's 99.6% of back pain goes away from the disc when you perform this particular surgery. Now, if the patient has other causes of back pain, like the facets, the piriformis muscle, the sacroiliac joint, those sources of pain will still be there after the surgery. So it's important that patients treat all their sources of back pain in order to get all the relief that's possible, to get 100% basically by treating everything that's painful. But each treatment requires its own specific treatment to the pain generator. Now, what is a pain generator? Pain generator is something that causes pain. There's your tear right there. You guys see the tear, the blue stuff in there?
Yes, we do.
So Henry, let's show the audience how we use a laser to get rid of back pain from a disc when the disc is the source of the back pain.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
The video you just watched shows how Deuk Spine Institute is able to eliminate the inflammation happening in the back of the disc, therefore eliminate the back pain coming from a disc problem. Now, an injured disc is the most common cause of back pain, chronic back pain. Number one is an injured disc. And lots of people have injured discs, but they have no idea they have an injured disc as the cause of their back pain. That's why we produce these educational videos, to help people understand the source of their back pain. Most doctors are absolutely in the dark about what causes chronic back pain. They can't tell you your source of back pain. They can't tell you at all. So there are unfortunately millions of people in the world living with back pain, and their lives are being ruined by this horrible pain in their back. Okay? None of these people want their back pain. They want to get rid of it, but they don't know how to get rid of it. Well, Deuk Spine Institute is the first in the world to pioneer the cure to back pain and neck pain through our proprietary diagnostics and treatments. You won't find these treatments anywhere else in the world. We have them here for your benefit, to get out of pain. I've tried teaching other doctors these treatments, but they want to continue to do invasive surgery that frankly pays them a lot more money than this procedure. This procedure does not pay surgeons very well, therefore surgeons don't recommend it. That's the biggest problem. Fusion surgery, artificial disc, spinal cord stimulators, they pay the surgeons a lot more money than they get paid with this procedure. As a result, they're out there recommending these invasive treatments to patients, like spinal cord stimulator, laminectomy, discectomy, fusion, artificial disc, mild procedures. I mean, you name it, they're out there doing these treatments, recommending these treatments that are actually harmful to the patient's body. They destroy muscle, ligaments, bone that are all normal muscle, normal ligaments, normal bone during those invasive surgeries that we're trying to get people to avoid, because they don't work to cure pain, and they're highly invasive and unnecessary now that we have these very elegant treatments. All right, let's take a question or two if the audience has one.
Yes, we do. Two of them. First one coming from Darren on Facebook.
Welcome, Darren.
Asking, do you do scoliosis corrective surgery?
I do. I do scoliosis corrective surgery. And I usually will tell people not to do it because it's not necessary. Most people think scoliosis is the cause of their pain in their back, but it is not the cause of pain. It is almost never the cause of pain. And the only thing scoliosis really does is cause deformity. Now, when scoliosis gets really bad and the curve is really bad, then it can start to interfere really with somebody's life, because their functionality decreases because the scoliosis is twisting their spine so severely. But of all the scoliosis patients that have scoliosis, only about 3% need scoliosis surgery. And those are the people with curves somewhere around 60 degrees or higher. Okay, the vast majority of people with scoliosis do not need scoliosis corrective surgery, even though their doctors are telling them they need it. Their doctors are telling them they need it because the doctors, number one, don't know how to cure the back pain without doing scoliosis corrective surgery. And number two, scoliosis corrective surgery is the highest paying surgical procedure in the world for spine surgeons and any surgeon. You make the most money doing scoliosis corrective surgery. Yes, I used to do a lot of it, but I've gotten rid of it now. I don't do it anymore because it's so invasive. And frankly, it's unnecessary. Patients do not need scoliosis corrective surgery. They need to get out of pain. So the function can be restored to the patient's body without doing scoliosis corrective surgery, but you need the right diagnosis. Good question. I hope that answers your question. By the way, I do have these scoliosis corrective surgeries on our YouTube channel if you want to watch them. They're under the title TLIF, Transforaminal Lumbar Interbody Fusion. And if you watch my TLIF surgeries, you'll see that I correct scoliosis. I used to do it every week. We used to do several of those surgeries back in the 2018, 19, 14, 15, 16. And then I learned that those patients actually did not need to have such an invasive surgery to get rid of their pain. They just needed the laser surgery that you're watching right now. And this surgery will get rid of their pain. So if it's pain that bothers you, then get the Deuk laser disc repair or the Deuk plasma rhizotomy. These are much safer, less invasive, faster recovery surgeries. You don't need scoliosis surgery just because you have scoliosis. Okay? Of course, the other spine surgeons would love for you to believe that you do, so they can make a lot of money doing your surgery. But those surgeries are extremely dangerous and painful, long recovery, and they're full of complications. And you don't need any of it. None of it. Zero. Zippo. So, best thing you can do is our free MRI review with me, and I'll tell you if you need scoliosis corrective surgery once I interview you and examine you. All right, we're almost done with the first disc. We're going to move on to the second in just a moment, but this is going quite well for the patient. He's again from Canada, came with his family here, and he's doing very well, right, Dr. Berndes? Any other questions, Henry?
Yes, we have a question coming from Lanu on YouTube asking how much cost for a fusion?
Fusions are expensive. The cost of a fusion depends on how many levels we're fusing, whether or not we're doing cages, how many screws we're putting in, how many cages we're putting in, how many osteotomies we're doing, how many laminectomies we're doing, how many interbody fusions we're doing, how many posterolateral fusions we're doing. So it all just depends on what we're doing. Every fusion is different. There are many, many ways to do fusion. And unfortunately, there are many doctors that cut corners to save cost. I don't do that. If I'm going to do a fusion, I do it the right way. So fusions can cost anywhere between $50,000 US all the way up to $500,000 US or more. I think the most expensive I've ever done was $500,000. And that was a scoliosis corrective surgery. I'll tell you this, if the Deuk laser disc repair fails to work on a patient, we would be doing a fusion as the salvage procedure. How many times in the last 20 years of doing Deuk laser disc repair have I had to do the salvage fusion? Luis? None, he says. That's right. Zero. We have never had to do a fusion on a patient that had Deuk laser disc repair because it didn't work. So every one of our patients that, by the way, this patient, if he had gone in Canada, he would be recommended for a fusion. That's what he was recommended for. That's why he came here. I can't tell you too many details about the patient, but I can tell you that they were referred by another patient from Canada who we operated on successfully, cured their pain, and now this patient's here. So That's typically how our business works. We get referrals from other patients that we've already treated. That's who comes here.
We have a couple more questions.
I'll take them. I'm almost done with this disc. I thought I was done, and then I saw a piece of herniation I had to get rid of. This is the last, hopefully the last final touch right here. This was quite a bad one though. This was L3-4. Go ahead.
This next question is coming from Faisal on Facebook, saying, "Hi doctor, hope you're well. Can I ask you, when you do the laser disc repair surgery, we can see a camera under a tube seeing what you're doing. But we don't see that in your rhizotomy treatment. Why is that? And is it possible we can see you cutting the sensory facet nerve? Thank you."
Great question. We don't use the endoscope during our rhizotomy treatment. Nobody does. It's an outdated technique that doesn't work well. We use the X-ray machine to guide the rhizotomy. So, surgeons use different ways to guide their surgery. Some use their eyes, direct visualization. Others use X-rays, and others use microscope. Others use endoscope. But this surgery in particular you're watching now is endoscopic. That's why you can see. You see what I see. On the other hand, with the rhizotomy, there is no endoscope. It's all done with X-ray, and you still see what I see. So I just use a different tool to visualize the target and the trajectory and navigate. Faisal, when are you going to get out here and get fixed? All right.
All right. Next question coming from Darren, once more on Facebook,
Sure.
asking, are more insurance companies covering DLDR?
No, more insurance companies are not necessarily covering DLDR. Insurance companies do not want you to have any surgery at all. Surgery is expensive. To insurance companies, one of the most expensive things they pay for is spine surgery. Okay, hundreds of thousands of dollars on average per surgery. For fusions, insurance companies will pay anywhere between $50,000 and $500,000. So insurance companies do not want people getting spine surgery. So they're not going to cover more spine surgery for you. They want to cover less. As a matter of fact, over the years, I've seen insurance companies cut back on what they're covering dramatically when it comes to spine surgery. They're making it harder and harder and harder for patients to get spine surgery covered. They're denying even fusions. They deny artificial discs. They deny laminectomies. They deny paying microdiscectomies. So insurance companies are going the opposite direction. They're not covering more procedures. They're covering fewer. And they do not want to cover the Deuk laser disc repair because it actually works. It's the only surgery that actually cures back pain and neck pain. So they are not wanting to cover a treatment that actually works because more people are going to want to get it done. And that means they're going to spend more money on you guys. Insurance companies make profits by not paying your medical claims. They make profits by not paying your medical claims. Now, many insurance companies even hide their profit. They call themselves non-profit, and what they do is they take the profits out under subsidiary companies that are stealing the money out of the system legally by, basically paying, for example, let's just call it shredding services. Okay, so take an insurance company, health insurance company, and they're not allowed to make by law, they're not allowed to make huge profits. The government is regulating their profit, right? But it's a joke because the government is regulating the insurance company's profit, but it doesn't regulate the profit of the companies that the insurance company does business with. For example, I could make a company that provides janitorial services for the insurance company building. And those janitorial services may be worth $50,000 a month. But if I own the janitorial company and I'm the owner of the insurance company, then I can own the janitorial company, contract with myself, my own company, And instead of paying $50,000 a month, I'll pay $500 million a month to the janitorial company that I own. So I'm siphoning off the money really by gaming the system and taking all that profit out as the janitorial company rather than the insurance company. So the insurance company remains a nonprofit, like Anthem or Blue Cross is a nonprofit. And on the books, they look beautiful, but if you go through their books and you audit them, you will find that they are siphoning off billions of dollars in premiums and paying these crooked, corrupt owners. In the meantime, they're denying 850 million medical treatments a year. That's a report out of the Wall Street Journal earlier this year. 850 million denials every year by health insurance companies not paying for treatments. So, Deuk laser disc repair, probably 300 of those denials a year. So 300 denials a year for Deuk laser disc repair. That still leaves 849,999,700 denials for other doctors and other treatments that are recommended. So you go figure. The insurance companies are basically robbing our healthcare system blind, right under the nose of President Trump and all those people, Joe Biden and Kamala Harris and everybody else that's run this country for years. They are robbing the American people blind of their healthcare. That's why we're ranked 63rd in the world now, maybe it's even lower, in healthcare. Why? Because we used to be number one not long ago when the insurance companies were paying for medical care, good medical care. But now they can deny whatever they want. There's no accountability for the insurance company. They don't get in trouble because they rewrote the laws to protect them and allow them to deny treatments. They just call it experimental or not medically necessary. They call brain surgery experimental. They call spine surgery experimental. They call MRI experimental. Okay, they're getting away with this because they basically write the laws. Our lawmakers are letting them do it because the lawmakers are being funded. Their campaigns and are being funded by the insurance companies. By the way, if you want to know more about this, there's a movie out there called Spine Scam. Spine Scam. It's on YouTube. You can watch it, Spine Scam. Just look it up on YouTube, do a search. And that movie is, I think, the first, hopefully, of a series of movies that's going to expose the corruption in the healthcare system, at least in the United States and probably the world, because the rest of the developed world has the same corrupt players as the United States. So if you watch Spine Scam the movie, which is available on YouTube, then you can start learning about how the system is robbing you, the patients, from your benefits of being healthy. All for greed. Henry, you want to add anything to that?
I'm just excited. We have it up. We're ready to go with it. And I've been talking with the director of just really pushing it forward. And I'm just happy that it's out and people are able to watch it.
Good. Well, let's see if the people do anything about it.
Of course. And given that, we have a lot more questions.
Sure.
This next two are coming from Mike on YouTube. First question asking, did this patient have numbness in his foot?
I believe he did have numbness in his foot. Numbness in the feet can come from a few things. One is pinched nerves in your back, which is what we're fixing right now. The other is a thing called neuropathy. Now, neuropathy is a condition where the small nerves get destroyed in your body. And what destroys them, the most common thing that destroys them is diabetes. But there's other things that destroy small nerves. For example, alcohol consumption. If you drink alcohol a couple ounces a day, you can start destroying those small nerves. Remember, alcohol is toxic to nerves. Toxic. It kills them, either in your brain or down in your feet and hands. Alcohol. Another is B12 deficiency. That causes neuropathy as well. Another is folate deficiency. Not enough folate in your body. There's a list of about, 100 things that cause neuropathy. So if you have numbness in your feet, the most important thing you can do, go see a good doctor and get what's called a nerve test. The nerve test, EMG nerve conduction study, will diagnose hopefully why you have the numbness in your feet. Then you come and do an MRI review at Deuk Spine. Take some more questions. Good question, by the way. Thank you.
Next question from Mike, once more on YouTube, asking how much is bilateral L5 to S1 Deuk laser disc repair?
Yeah, I don't know the pricing. Great question. You're going to have to do an MRI review to get your pricing. That's the only way you're going to get it, because after the MRI review, somebody will call you from the business office and they'll tell you exactly what the cost will be for you. It all depends on insurance. It depends on what's being done. So you got to talk to one of our schedulers. Good question, though. Thank you for asking.
Next question coming from Lanu, once more on YouTube.
All right, Lanu.
Asking COVID question. Do people still wear masks when they come in?
Do people wear a mask when they come into our clinic?
Correct.
No. COVID, I think here, at least in Florida, there's nobody really wearing masks anymore. I don't see anybody wearing masks anywhere. Not at the grocery store, not at the restaurants, not in public. Are you in Indonesia? I think she said she was in Malaysia, right?
Malaysia or Indonesia, something like that, yeah.
Yeah. I would love to go to Malaysia someday.
Same.
I talked to my wife about it. She wants to go visit.
Oh, and we just got another question coming from Pavel on Facebook.
Pavel?
Pavel, correct. Saying, hi, Dr. Deuk.
Hi.
Before performing piriformis muscle release, do you confirm with an MRI scan or just rely on consultation and symptoms with the patient?
Yeah, great question. No, the MRI is not going to show you the piriformis muscle tear. So there's no point in getting it. But we do get an MRI because we want to rule out any other causes, right? So we're going to get an MRI period just to see if you got a herniated disc, if you got a tumor, if you got an infection, you got something else that could be causing those symptoms. But if your MRI is done and there's no tumor, fracture, infection, anything serious, then we just do a clinical diagnosis, which means I diagnose it using our Deuk spine exam. So it's not as simple as just checking your butt. You got to rule out other causes. So as part of the Deuk spine exam, the Deuk spine exam is proprietary. We developed it here at Deuk Spine Institute, and it's special tests that we do. It's a combination of physical exam plus diagnostic imaging plus history. And combining all those things together, we're able to make a diagnosis. So it's not just based on an MRI or herniated disc or something like that. It's complicated, and it takes into account many years of experience in treating back pain and all of the causes of back pain. There is another test that can be used to confirm piriformis. It's called the piriformis muscle injection. That's where we use ultrasound or X-ray, and we basically put a needle into the piriformis muscle and inject medicine into the muscle. The medicine is a numbing medicine, and it tells us if the patient will tell us afterwards, hey, my pain's better because you did that injection. The pain's gone away, and that tells us that we were right. It's a piriformis. But I usually don't need to do that because it's pretty obvious to me on exam. Good question. If you haven't watched Spine Scam, I just want you all to know the movie is now out. We decided to release it for free. We wanted everybody to be able to watch it for free and not have to pay. Obviously, you still need YouTube and an internet connection, but it's going to be on YouTube. So it's on a free streaming service, and you can learn about the corruption happening in the spine industry between surgeons, hospitals, and implant companies that manufacture these implants and devices used to treat spine conditions. It's the first of a series. We're hoping to release more movies called Spine Scam 2 and 3, and there'll maybe other titles, but this is the pilot. We want to see how it does. If it does well, then we can continue to expose the corruption in the healthcare system and make people aware of the corruption that's going on. You can't fix something you don't know about. Right? Before you can fix a problem, you have to know there is a problem, and you have to understand the problem. That's the only way to solve a problem. Right, Berndes? Doctors do it every day as part of our practice. Yeah. You got to know there's a problem first. Then you got to find the source. And then you can fix it. Getting a lot of pieces of herniation, but almost done. Here we got one more disc to treat, the L5S1. Each one of these clumps is a piece of herniation. I'm done with the laser. I just got to finish getting all the fragments out. He's got a very old disc injury. There's lots of pieces of herniation, all of them stuck down. I've been using the laser to release them, but he's got so many pieces of herniation, maybe 100 per disc. Typically we're going to see 30 to 50, but this is an older patient who has had back pain for how long? 25 years. He had a fall. Keep the tube straight if you can. Yeah. Yeah, he's got other issues. He's got fractures in his spine as well. We're going to be fixing those. Not today, but tomorrow. Almost done. Any other questions, Henry?
Yes, we have a question coming from Mike, once more on YouTube, asking the large disc protrusion / herniation at L5 to S1. Will it still show up on a future MRI, and will it no longer compress nerve roots after you finish? Thank you.
Yeah, great question. So the large herniation at L5S1 will definitely be smaller. It won't be 100% gone. There's no surgery in the world that can make it 100% gone. But it will be smaller, and it will be asymptomatic with the Deuk laser disc repair. What that means is we're going to make it smaller and it won't cause any symptoms. Remember, everybody out there has disc herniations. Every single human being over the age of 45 has a herniated disc, but we have no symptoms. Only about 10 or 15% of people have symptoms. And the reason is that most herniated discs are asymptomatic. We don't know why. That's just the way it is. I don't make the rules, I just follow them. So I guess it's a good thing that most herniated discs are asymptomatic. God damn it, this fucking thing is in there. Won't come out. Does that answer his question?
I believe so. Yep. And at this moment, no current questions.
Well, in that case, let's show our audience one of our patients who had this procedure done.
Of course.
And good morning, Dr. Deuk Majin. It's July 17, 2024. I'm here with one of my Floridian patients from Punta Gorda. He just had his lower back fixed with two procedures, the Deuk laser disc repair for some bad discs and the Deuk plasma rhizotomy for facet joint pain, which we discovered when he showed up here and I examined him and found his facet joints were hurting him. You just had your surgery yesterday. You can see in the video, we went in and cleaned out two discs and got the pressure off the nerves. We also did the Deuk plasma rhizotomy on your facet joints and destroyed the pain nerves. How do you feel today?
I feel good. Yeah, I don't have any pain.
So the surgery helped?
Oh yes, surgery definitely helped. Yeah.
What was life like for you before the surgery? Why did you decide to have it?
I couldn't do anything. I couldn't walk. I still try to get around a little bit because I'm general contractor and I try to help my son out. I help the last, I'd say 6-8 months I've been in my chair and that's it. Watching TV and that's about it.
Because of the pain in the back?
Because of pain yeah.
And you've had a rough time because you had some fractures in your spine which had kyphoplasty cement put in, which looked good. And then the discs were the problem now as well as your facet joints. And we were able to fix those yesterday.
Yes, I went to a different doctor over in Fort Myers who did the cement jobs. I thought that's all I needed. That's what one doctor said. Oh yeah, you just got these 4 fractures, I guess.
Yes.
Yeah, we'll fix that. You'll be fine. Well, it didn't do anything when he fixed that.
Well, and now you notice a difference.
Yes, definitely.
And you're not on any new pain medication that we gave you.
What? I haven't taken any pain medicine.
No pain medicine.
No.
And you're still feeling like the pain is gone. So yeah, I believe it worked well.
Yes.
Anything you want to say to your friends or family out there?
No, I'd definitely recommend Dr. Deuk for someone who has a back problem. Certainly, this disc laser surgery, I guess, he's the only one that does it. Seems to be the best way to do it. Like I say, I would recommend it. And a matter of fact, I have a cousin that has been having problems for quite a while. And when he gets back down here, he's coming back to Florida. I'm going to have him call Dr. Deuk, see if he can set up something.
Yeah, we'll take care of him. Don't worry. What's his name?
Kent LeDuc.
We'll look for Kent LeDuc. All right, sir. Well, enjoy life. Get those muscles back in shape. If you need anything, you call me. You have my cell phone.
Oh, thank you very much.
You're welcome.
Yep,
You're welcome. Thank you. All right, welcome back. We are advancing our dilator into the L5S1 disc. Huh? I think we're good. Keep going. A little more. A little more. I think we're inside. Yeah, we're good. So we just placed the tube into the L5S1 disc. We've completed 2 disc repairs. We've got 1 more to go. This is the most painful disc. We tested all 3 discs before while you guys were watching the other video. The L34 was 8 out of 10. Excuse me. I need to show them. Okay. The L45 was 8 out of 10. The L5S1 was 10 out of 10. And they were all concordant, meaning they were causing his typical pain. We asked him, is that where you typically get back pain? He said, yes, that's my typical pain. That's the best we can do in medicine today, folks, to figure out what's causing people's pain. A discogram is a great test. We only do it, I'm certain of the source of pain before surgery. I've never been wrong on a discogram. I've never said, oh, your L5S1 disc is the cause of your pain based on my exam, the MRI. And then I get in there and do an L5S1 discogram and it's normal. The patient has no pain. So I use it as a confirmatory test where we're confirming, and I've never been wrong about it. That's because I have a lot of experience treating back pain and curing it. And when you're able to cure back pain, you're able to see the results of your treatment and you're able to see a cure. And that's important because having that result of cure tells you you did something right. You see, if you don't have any result, then you don't know if your treatment's working or not. I mean, you know it's not working actually, which is most treatments for back pain, right? Doctors don't do treatments for back pain today because they work and cure your pain. They do it because they may give you some temporary relief. Temporary relief is not good enough. For example, you can do an epidural and have zero pain relief, no relief at all. Now the doctor will say, well, it was justified because epidural sometimes doesn't give any relief. But it's still okay to do it. As a matter of fact, the insurance company will pay for an epidural even if the patient has zero relief. So think about that. Insurance companies pay for an epidural shot even though you have zero relief. The insurance company will pay for physical therapy even though you have zero improvement. The insurance company will pay for surgery even though the patient doesn't get better. But you have one surgery in the world where there's a cure to back pain and the insurance doesn't want to pay. Why? It's obvious. Because they don't want people coming and getting the surgery done. They don't want to pay for it. They don't want, because they know there will be millions of people wanting this surgery you're watching right now, the Deuk laser disc repair, because it works and it cures pain. For many years I didn't understand it. That's because I went into it thinking, well, the insurance companies are going to want to do what's right for the patient. They're going to want to help the patient get better. That's because I thought insurance companies were actually good. Then I realized the health insurance companies are not good because they're not paying for things that people actually need. And it wasn't just the Deuk laser disc repair. You could order an MRI scan on somebody's back and they'll deny it and they'll say it's not medically necessary, we're not paying for it. And it turns out the patient can't afford to pay for it. So why is the insurance company not paying for an MRI? I mean, they're only paying like $300. So why would they not pay for a test that will show us what's wrong? And the answer is because once we find what's wrong, we're going to want to treat it and fix it. And they don't want to pay for that fix. So they're denying the diagnostic test. They won't pay for the diagnostic test that will show us where the pain is coming from because they don't want us knowing where the pain's coming from. You see, the insurance companies want everyone to believe that number one, back pain has no cause, and number two, back pain has no fix. And they're doing a damn good job of convincing you all that. And the doctors are, for the most part, doing exactly what the insurance company wants. They're doing treatments that don't work and don't last. And I'm different. I won't do that. I won't do treatments that don't work and won't last because I think it's unethical to offer a patient treatments that don't work and don't last. That's not why I became a doctor. I became a doctor to help people get better, not to do what the insurance companies want me to do, which is what 99% of doctors are doing out there. By recommending the treatments the insurance companies want to pay for, they are doing you a disservice because they're giving you a treatment they know doesn't work. The insurance company knows it doesn't work, and yet they do it because they want you to realize it doesn't work so you don't do it again. It's a crazy system. And that's why we created the series Spine Scams, because we want to expose all these truths to the public. But we can't do it without your support. So go watch the movie and tell us what you think about it. Henry, I think you should add that tagline. Tell us what you think about this movie. I want to hear their feedback.
Yeah, I can add that right now.
We already know they're going to say one thing. There's too much cursing in the movie, right? Too much profanity.
I would agree with that. Yep, a little bit.
But that said, that's okay. That's the kind of feedback we're looking for. That said, that's how these people talk. All right?
Of course.
Grab her. 5 minutes on this one, and then we'll go to the facets. How many of these grabbers we have?
Probably have like
Huh?
probably 10 or more.
Oh, okay.
Yeah, we're good.
How's your sunburn, Des?
They're okay. They're coming to visit.
Yeah, when are they coming?
They're coming Friday morning.
Wow. Friday morning. That's awesome. All right. Well,
We're gonna go fishing.
listen, I'm all for that as long as it doesn't interfere with patient care. It's not going to interfere with patient care, right? I just asked you. Just say no, it's not going to interfere with patient care. All right. Hector's covering doesn't mean it's not going to interfere with patient care. I don't know what next week looks like. I know Kim is putting some cases on. You'll be available by phone no matter what.
Yeah, I'll be here ready to go Tuesday.
I know you will. But will the patients be ready to go Tuesday? Right, Luis? See, Luis can appreciate my thoughts. Luis knows how I think, and he loves it because I'm right? And I'm not afraid to say it. I'm not afraid to say what's right. How are we doing, Han?
All is well. As of now, no current questions.
All right. Well, we've shown quite a bit. We're just about done. We've got maybe 2 minutes left. And if you have a question, feel free to ask. Okay, this is the L5S1. Remember, this disc is far more degenerated than the others. There's less herniation for me to take out because of that, even though it looks like a big old herniation on the MRI. We're very targeted. We enter right where the herniations are on the back side. All this is pieces of that herniation. You guys see me taking them out? These are parts of the herniation. It doesn't come out, unfortunately, as one big piece. It comes out as little pieces. I wish it came out as one big piece. It would make my job a lot easier, right? But you got to be persistent. You got to go after every one that you can get. And again, we'll never get 100%. We're going to get somewhere around, 50, 60, 70%. We need 50% to have a win. That's just a number that I think is appropriate based on my experience of doing this. I think around 50% is the right number. So I tell people, don't bother looking at MRIs. That doesn't tell us if we're successful, right? What if I got 100% on the MRI, but the patient had the same pain? Was I successful? No, I wasn't successful. Answer that question. Let's say we got an MRI. Patient has the same pain after surgery as they had before surgery. They're no better. And I go get an MRI and the 100% of the herniation's gone. Was I successful? I want to hear from our audience. I already know my answer. My answer is no, I was not successful because I didn't fix the patient's pain. Okay? What matters is the patient and their pain. So to be successful, we have to cure their pain. They have to say we were successful. I can't say we were successful. I can't get an MRI, huh? You treat the patient, not the MRI, as Dr. Berndes eloquently says. See, that's what Deuk Spine's all about. That's what makes us different. We know we can cure the patient's pain, and we expect to cure the patient's pain with our procedure, okay? And That's how we define success at Duke Spine is, did we get rid of your pain? Did we also not have a complication? We've never had a surgical complication ever. In 19 years of doing this surgery, not a single surgical complication, not a single infection, not a single nerve damage, not a single, whatever. Spinal fluid leak, nothing. Our patients do very well, and they go home an hour after surgery. All right, thanks for joining us. We'll be back in a few minutes to do the second procedure for this patient, which is the Deuk plasma rhizotomy for facet pain. All right, so we'll be seeing you in a few minutes.